Good morning, Thrivers. How are you today? Nurse Mary here. I pick you up where the medical system dropped you off. And every day I have a heart-to-heart with you. And today's heart-to-heart is about lab work. And I'm going to give you a little story about a client of mine. He had arrhythmias. And he had to go to the hospital. He was going for an echocardiogram routine. He wanted to get checked up, and we had talked about it. And I said, yeah, I think that's a good idea. Check the structure and function of your heart. Let's see what's going on. So he had a heart attack. So he had his blood work drawn, and he had arrhythmias. So they wanted to do a ablation on him. So first he had a cardiac cath, and everything looked okay as far as his stents and his coronary arteries, and he had reversed some blockage. But he had these arrhythmias. And so the next day they scheduled him and put him on the table for an ablation. And there was recently another case about this that I posted. And so he was put on the table for ablation, and they got in, and they couldn't find any, I call it an itchy area, the area of the heart that is causing the arrhythmia. And so last night we took a deep dive on his labs, and it turns out his thyroid is very high. And what happens when you have a high thyroid? It can cause arrhythmias. So another lab that was out of whack was his A1C. He's now diabetic. Never was diabetic before. But what medication is he on? He's on statins. And I've said over and over, statins can cause diabetes. His cholesterol is super low from being on the statin. And what does a lack of cholesterol do to our hormones? It causes them to go bonkers. And I started out this conversation by saying his thyroid was way up. So, and why would his thyroid be up, and why would his cholesterol be low other than statins? He may not be getting enough vitamin D. And what does cholesterol do? It is excellent for the brain. First of all, the brain needs it most. And that's why your liver makes it, is when your body needs it. So cutting off your cholesterol supply, or the ability for your body to make cholesterol, is catastrophic for the healing of your body. The problem is not the cholesterol. Cholesterol is a first responder. And blaming cholesterol is like blaming a fireman at the scene of a fire for the fire. You're blaming cholesterol when really cholesterol is coming to patch up inflamed arteries and inflammation. So what's the real problem? Inflammation. And and also stress. Stress can cause inflammation. Stress can cause our hormones to go wacky. Stress can cause insulin resistance leading to glucose. So this could be another confounding variable in there that is causing these problems, but it didn't originate from the heart. And most heart disease does not originate from the heart. So to review, he had a thyroid problem, and the thyroid is probably caused by lack of cholesterol / stress. He's had a lot of life stressors. He's got high A1C, and that's elevated by the statins. So he's got the statins affecting his hormones, his A1C, and his ability to repair and fortify the brain. So you see, this is why he was put on the table unnecessarily, and this is why medical error is the third leading cause of death. And there's a risk of death in these kind of procedures. So imagine what could have happened. And so this is why you always want to ask, and now he's on an antiarrhythmic medication needlessly. It's called amiodarone, which is very toxic for the heart. And guess what? One of the side effects is it can cause arrhythmias. People, it's time to get smart. And I'm Nurse Mary. I pick you up where the medical system dropped you off. If you want to learn more, check out my program. It's on my website. It's called the Heart Health Accelerator. And I flip over tables and pick up rocks and look at everything going on. Because a lot of times what you think is the problem is not. And it involves a lot of sleuthing because our bodies are chemistry sets and everything's connected. So it's not just a matter of one thing. Sometimes it's whack-a-mole and it takes a while to find things out. Okie doke. That is the message for today. Time to really absorb myself in this nature. Remember, get out there and move your body today because it'll be great for your mind. And it's great for stress release. And what does that do? It helps your heart. Exercises. Stress release decreases inflammation. And it allows for a clear and positive mind. And many other things. So have a great day. And remember that you've been given this gift of a day. I'm offering you a gift with this program. And some people are lying in bed taking their last breaths today and did not have the opportunity you have. So make some changes, and you can book a call with me through my website as well if you really want to talk and you're really serious. All right, have a great day.